everyone, my name is Dr. Lina from Dental101. Today we are going to have a small video which I think is quite important for everyone that is starting to get into the habit of understanding OSCE communication stations. I think this particular topic, it is very important for every single candidate to have it very clear in their minds, because the concept of how the clusters that they are going to be evaluated in the OSCE communication stations are divided is quite important here. So today we are going to have that video just to give an overall and a quick overview about the concept within every single one of the clusters. Copyright and disclaimer. All content included on this presentation is property of Dental101 Pty Ltd or our associates and protected by Australian and international copyright laws. You may not copy, reproduce, distribute, publish, display, perform, modify, create derivative works, transmit, or in any other way exploit any part of copyrighted material without permission from Dental101 Pty Ltd. Dentistry is both an art and a science, and pursuing a course with Dental101 does not guarantee pass or success. We are helping build upon the candidate's overall clinical knowledge and experience within the framework of examination preparation. The candidate is expected to have a certain baseline knowledge and experience. The content of the course is evidence-based, and it is a candidate's personal discretion as to how to use this information. Dental licensure examination pattern and requirements are ever evolving. The pace of learning and use of knowledge is different for every individual. Okay guys, so what you are seeing right now on the screen is something that I have taken from the ADC handbook. So this is something that every one of you who are preparing for ADC Part 2 needs to read, and you probably are familiarized with this. So the first thing that I want you to focus on is the second column of that little box that we have there. And that second column is basically referring to the method of assessment. So you are going to have two methods of assessment. One method is going to be the OSCE, and the other method is going to be the technical tasks. So just so we clear that out of our way, technical task is the ones that you are going to be doing during your technical day. Basically, those technical tasks are going to evaluate 6 different tasks from you in order to see how your technical skills are. If we are talking specifically about OSCEs, as you are seeing here, you will have, and let me just try to highlight it here, 3 different domains. The first one is going to be clinical information gathering. Very important. This one represents the first appointment that we have with every single patient on a daily basis. Every time that you are seeing a patient for the first time, in real life, what is going on is a clinical information gathering phase. Because the patient comes usually with a problem. Sometimes they are not, but even if they are just coming from a comprehensive examination or preventive care appointment or clean, however you want to call it, you need to do some kind of information gathering. So basically this cluster is telling us this is the first encounter that we have with our patient, and that's something that we call clinical information gathering, because we want to know about the patient medical history, the patient's dental history, chief complaint, family history if applies, everything that involves the chief complaint, and also everything that can influence the outcome of your treatment. So that's the first cluster that you are going to have. It's quite important for you to be able to identify the clusters when you are in the exam. Remember, during your OSCE day, you are going to have 10 stations. Of those 10 stations, 6 are going to be OSCEs. You can see it here on the screen. Clinical information gathering is going to have 2 tasks. Diagnosis and management is going to have 2 tasks. Clinical treatment evaluation is going to include the 2 OSCE, communication, the 4 skill OSCEs, and the 6 technical tasks. So right now you can see how that last cluster is going to be permeating all of those tasks that you have during your technical day, and also the skill OSCEs. So basically for the clinical information gathering, traditionally, and this can change, so don't take my word for it, traditionally station number 1 and 2 are clinical information gathering informations. Then we have station 3 and 4 that are going to be diagnosis, management, and planning. And stations 5 and 6 are going to be clinical treatment and evaluation. Now, take in mind and keep it at front of your head that you are going to enter these rooms in different order. I can start with room number 10, but everything that is or has the number 1 to 6 is going to be an OSCE communication station. So, how am I going to spot if what I'm seeing in front of me is a clinical information gathering? So basically, these cases doesn't have too much information. It's just a vague description of the patient's complaint. For example, patient comes to you because the patient has pain on biting. And they can give you, something else over there. The last visit to the patient was 3 years ago, and the patient has pain on biting, and also, something not specifically telling you about the results of any particular investigations. So during the clinical information gathering, you are not going to have too much information. You are not going to have any results about investigations, because if this is the first time the patient is seeing you, you don't have any results. So basically what you need to start doing is to get out of the patient all the information regarding the chief complaint. So if the patient has pain on biting, we are going to ask the patient, can you tell me if it is when you bite down something hard or soft? Or can you tell me if you have any discomfort to water, hot water or hot or cold beverage? Can you tell me if the cold or hot triggers the pain? How long does it last? So it could be a different type of symptoms or signs that you are seeing there that you need to investigate further. That's why for clinical information gathering, you need to be like a detective, And then we are going to have diagnosis and management, which also is going to have 2 tasks. So diagnosis and management, basically here they are telling you, and they are going to give you all the information so you can jump into the diagnosis. So for these cases, you are going to have results of investigation, such as cold test results, percussion test results, probing results, frag finder results, x-rays, photographs. So in this one, you are going to have all the material. So there's no doubt in your mind that what you are seeing there is, for example, a periodontal abscess. Of what you are seeing there, it could be an avulsion. You have all the resources to jump to the conclusion that is so-called diagnosis. And then you can start telling to the patient, since you have this diagnosis, the management for that will be this and this and that. So that's the difference between clinical information gathering diagnosis. And then we will have the clinical treatment and evaluation cluster that is going to include what I just recently said, 2 communication tasks, 4 skill OSCEs, and the 6 technical tasks during the technical day. So for the communication OSCEs for the clinical treatment and evaluation, that will be the last phase of the patient's lifespan with you, as a manner of speaking. What I mean by that is that when we see a clinical treatment evaluation cluster, it's sometimes patients that have had any kind of treatment and a complication has arisen. For example, you were extracting a tooth and the mesial root broke. The patient is having a treatment with you. That means that you already did a diagnosis, and obviously you already did a clinical information gathering. So if you analyze very well the flow of the 3 clusters, they are all interconnected. Doesn't matter that there are different cases, but what they are trying to represent is the flow that you have with a patient every single time that a patient walks through the door. Because if you are going to see a patient for the first time, you do first the information gathering, then you do some examinations, and after that you reach to a conclusion, which is a diagnosis, you propose a management, and then you start doing the management. And if you find any complications, then you need to deal with that. So all of these clusters are telling you pretty much that flow that you follow with every single patient in real life. It's just that they want from you, how are you going to perform for every single one of those, because we cannot jump realistically. We cannot jump into a diagnosis if we haven't asked the proper questions. If we haven't asked the patient, how's the pain? Can you classify the pain? Is the pain allowing you to sleep? Does the pain lingers after you drink something hot or cold? So realistically, you cannot jump in a conclusion without asking all of these things. So that concept of knowing the difference between every cluster is quite important, because that way you can edit your OSCEs. One thing that we see a lot, and it's not an intentional mistake, but happens a lot, is that even though sometimes candidates are talking about clinical treatment evaluation, they are asking everything. Medical history, chief complaint. Why are you going to ask a chief complaint when the patient is already having the extraction done on the chair? That was already done. That was already done. So you don't need to do that again. So that's quite important for you to understand the difference, because it's not to repeat the same structure and the same speech for every single cluster. It's not about that. It's about differentiate clinical diagnosis and clinical treatment evaluation, so you can edit your structure according to that. So I hope this concept is not too confusing for you. But if you have any doubts or any queries, we have different methodologies here at Dental 101. We have something that we call the OSCE communication body, which is basically one-on-one sessions with us as instructors in case you want like a more appropriate and on-point feedback. And we can discuss all of these subjects, obviously, in OSCE communications. For people that have done our courses, they know that this information is also included in the comprehensive courses that we offer here at Dental 101. So if you definitely want to have more information, please go to dental101.com.au or feel free to give us a call to 045-101-7076. Thank you so much.